Hi, my name is Tommaso Falcone. I'm the professor and chairman of the Department of Obstetrics and Gynecology at the Cleveland Clinic Foundation. And I'm also the chair of the Women's Health Institute at the Cleveland Clinic. I wrote and co-wrote this book with my daughter, who's in dietetics school, and the book is called The Cleveland Clinic Guide to Infertility. The book really resulted from 20 years experience where patients that came to see me were asking questions, mostly questions about details of management of infertility, what can I do to prevent infertility, and what happens, of course, if after all that treatment, I'm still not pregnant. And so after 20 years, I thought that perhaps I should put this in a book which would be easily readable for patients and couples who are infertile or even contemplating getting pregnant, so that they can have an overview of what are the important considerations in prevention of infertility, preparing, perhaps optimizing their own spontaneous fertility, and of course, if they have to go on to the high-tech stuff, what exactly it is. The intention, of course, is not to replace the consultation with your infertility doctor, but simply to provide an in-depth, easily readable analysis of what's out there in technology. So the book is really divided into different parts. The first part really focuses on prevention. So what are the big causes of infertility? Obviously, the woman's age, weight, sexually transmitted infections, and smoking are the big ones. And so if you're going to prepare for a child, you should consider all these things so that we can prevent infertility. Then, of course, there's different aspects: stress. How do we prevent stress? How can we manage stress? What about our diet? And therefore, after these years, I felt that it would be critical to include a section which deals with nutrition and how the nutritional aspects of infertility are important. The book does provide even recipes so that if patients that are contemplating pregnancy or infertile, what could they do at a practical level for weight loss or just to improve nutrition in general. And then the last part of the book deals really with the details of infertility treatment. So for example, simple things as ovulation induction drugs, whether we need to do ultrasounds, what kind of investigation, are these investigations necessary? An important aspect of that is also choosing the right infertility doctor. And I think this is very important because your doctor has to reflect your basic concepts of how quickly you want to move into this world of high tech. If you meet a doctor who's goes too quickly for you or too slowly for you, then there will be a breakdown in communication. I hope, therefore, that you can read this book and that it will be informative for you and somehow lead to a better outcome with your infertility problem. Thank you.